On this episode of the Paw Report, we revisit the topic of cancer and our pets. Getting a cancer diagnosis can be a scary moment for pet owners, but at the University of Illinois, cutting-edge research and technology are helping our pet companions live longer and happier lives. Veterinarian oncologist Dr. Kim Selting joins us to talk about that equipment and will show us a special machine shining light on radiation therapy.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
We welcome back to the Paw Report Dr. Kim Selting to catch us up on cancer research and technology here at the University of Illinois Veterinary Teaching Hospital. Thank you so much. The first time it was 4 years ago. You were in our studio, but you have graciously allowed us to come into your workspace to show us neat technology and even show us some of your work with a patient. So thank you very much for your time today.
Thanks for coming back. It's good to share. We have some really fun technology here. So
yes.
It's been good. We've had her, we call her Adele, our machine. We've had her for 4 years, and so we've been able to learn a lot about all the capabilities of this machine and everything we can do with radiation, specifically within cancer care for animals. So.
For the viewers that maybe don't know you, can you take a moment to reintroduce yourself and your journey to the U of I?
I grew up in Colorado, if we want to go all the way back. I did most of my schooling there. I did undergraduate vet school and then went back for a medical oncology residency there at Colorado State. In between vet school and the residency, I did an internship in New York City, spent some time in private practice, and then after my medical oncology residency, I joined the faculty at the University of Missouri and was on faculty there for 15 years, and during my time there I had always had a really strong interest in radiation as well, and so I was able to arrange a second residency during my faculty time there, and got boarded about 10 years ago in radiation oncology, and then had this opportunity to come to the University of Illinois to start a program. They've had radiation here for a lot of years, but they haven't had a radiation oncologist had not had someone for I think probably 10 years or more. And so we had a very, very old machine when I came here. It's an old Cobalt machine, which is very reliable, but very limited in what it can do. And so for the first 2 years, I worked with that machine. And then we got the linear accelerator, the True Beam linear accelerator from Varian. And that was 4 years ago, almost exactly June 18th is when we treated our first patient. So
about the same time as we're recording this now.
Of 2019, yeah. So right at 4 years ago, we started with this machine, and so I've been working on growing that program. The first goal was to set up a good clinical program to be able to treat animals with cancer. Then we added house officers, so I started with a specialty intern. She became my first resident. She finished a year ago, passed her boards, and is off working in the wide world. And now I have 2 more residents, and so we've been working on growing the research side of the program now as well.
How do you diagnose a companion animal, or how are they diagnosed with cancer? If a client comes in, some of the signs.
The way that we diagnose depends a little bit on where the cancer is and how accessible it is. If we have an opportunity, we will always collect some cells from the tumor and look under the microscope, and that will help us categorize it. We'll say, does it look like cancer? Does it not? Does it fit into a cancer of epithelial origin or mesenchymal or connective tissue origin? So that helps us kind of know what we're likely to expect, what kind of tumor it is most likely to be. Ultimately, a biopsy is often required to confirm a diagnosis for most of the tumors that we diagnose. So when we think about cancer, we have to think about the tumor that we found, and then we have to think about that tumor's behavior throughout the body. So that's called staging. The staging means looking for the extent of disease in the body. So once we know what kind of tumor it is or is most likely to be, that helps us decide which tests are most relevant. For example, mast cell tumor is very common. That tumor pretty much exclusively spreads by lymphatics. So if I could pick only one test, it would be checking a nearby lymph node. Whereas bone tumors, like the dog that you just saw here, they spread by blood vessels, and so the lungs are a more important target organ. We still check the lymph node, but we know that we need to look in the lungs to see if it has spread to the lungs. So both diagnosis and staging, or determining the extent of disease, are all part of what we do as oncologists. So, and again, to confirm the diagnosis, typically we're collecting cells and or collecting a biopsy. If we can't, we often are going on the behavior or the imaging characteristics. Bone cancer, for example, has a very characteristic pattern on radiographs or x-rays. And so often we can get pretty close to a diagnosis just looking at what it's done to the bone. And then if we want to confirm, we can take a sample. So, but sometimes that doesn't change what we do. Tests, I think, typically are done if they change what we do or if they change our perception of what's going on. So in other words, it might not change what I do medically, but confirming a diagnosis of bone cancer might help a pet owner have that peace of mind to know why they're making the decisions that they are making. For example, choosing to amputate, have a leg amputated is a big decision, and so they might want that confirmation. Even if the treatment is the same, whether it's an osteosarcoma or a fibrosarcoma, we still might be talking about amputation, but a test might help an owner have that peace of mind. So,
what are some of the common types of cancer? You mentioned bone cancer, other types of common cancers in dogs and cats.
Yeah, so we see a lot of lymphoma in all species, humans, dogs, cats. It's your immune system is very active, and it's always dividing and rearranging itself, and so there are lots of opportunities for errors that then could turn into cancer. So we see lymphoma with pretty frequently in all species. That is a cancer that is usually systemic by nature, so therefore a systemic treatment, in other words chemotherapy, is the most common treatment for lymphoma. But some lymphomas, like lymphoma limited to the nasal cavity, can be treated with radiation because they don't tend to involve the rest of the body. So lymphoma, mast cell tumor I mentioned, is a skin tumor that's very common in dogs, not as common in cats, rare in people. Bone cancer we see with some regularity. It's about 10 times more common in dogs than it is in people. It's a wonderful model for translational study. So, understanding what happens with the same cancer in another species can help you know more about the cancer in humans. So that it's often used as a model. We see head and neck cancer, so oral tumors, brain tumors. Something a little bit more unique to dogs would be anal sac tumors. So we see tumors of the anal sac that can then spread to nearby lymph nodes. So those would be some of the common ones. Hemangiosarcoma is one that is often seen in middle-aged or older dogs, often in the spleen. That's a particularly aggressive one that we see sometimes.
Do environmental factors contribute to cancers that you see?
So I think that when I talk to pet owners about cancer, it's a very common question to ask what caused it. Right. People want to understand both for the health of that animal, but the health of future animals and their own health. And it's very difficult to make a single cause and effect association. So in human medicine, we know that asbestos is strongly linked with developing mesothelioma, for example, but not all people who are exposed to it develop that cancer, and not all people with that cancer or lung cancer were exposed to asbestos or smokers. So there are both environmental and host factors that go into the development of cancer. For cancer to develop, it has to go through a whole series of steps of having multiple mutations that then confer a survival advantage that then can eventually grow into a colony of cells. They have to grow their own blood vessel, they have to get through the body, survive the immune system. So we're probably fighting cancer all the time. And yes, environmental factors probably do some of the DNA damage. Most of the time our body can take care of that. But there are not a lot of strong associations with environmental factors. Environmental tobacco smoke has been studied for its association with oral cancer in cats, nasal and lung cancer in dogs. So there's some associations there.
Do you find that there are certain breeds that are more susceptible to cancer?
I mean, we do see certain pure breeds. Most of the studies that we do are predominantly composed of mixed breed animals, but that is a more common pet. There are certain breeds that have cancer types that they're more prone to. So beagles and Scottish terriers are very prone to bladder cancer and lymphoma, for example. Boston terriers, boxers, those short snouted dogs sometimes get the mast cell tumor, the cutaneous mast cell tumor. Golden retrievers get a lot of tumors. They get hemangiosarcoma, they get lymphoma. We see golden doodles are very popular now. We do see some of those with certain cancers. So yes, there are breed associations, and there also are reports of familial associations. In other words, a high percentage of offspring in a line that can be genetically traced that develop the same cancer. So there is that genetic aspect as well.
What are the symptoms you see? What do you normally see, or what will pet owners tell you that they've noticed?
Yeah, so most pets with cancer are presented either because we find a lump and we don't know if it's cancer, and I think in general we know that lumps are not normal, or they present for signs that the cancer is causing. So in that case, it was a dog that was limping. You couldn't see an obvious mass in the leg, but the bone was changing and becoming painful, and so the dog was limping. So it depends on, I call them site-specific signs. Depending on where the tumor is, you might see changes in function or comfort that relate to the location of the tumor. If you have a tumor in the pelvic canal, they might be straining to defecate or urinate, or a tumor in the bladder, have straining to urinate. So I think typically things that are out of the ordinary, so watching for pets' attitude, appetite, and activity level, the 3 A's I call them, you know. So making sure those are okay. So if there are changes in those measures of quality of life, that can be a sign. I mean, most of the time when your animal isn't right, it's going to be something not scary. But finding it when it's early is going to be helpful. So when there are changes in your pet's health that don't get better with time, or don't get better, or are getting worse. The other thing about cancer is usually there's progression. So, you know, if you have an injury, it typically gets better over time. With a tumor, a lump that is growing, that should be a warning sign. So if we see masses that are noticeably growing over time, still might be benign, but we definitely should, any mass should get checked out at some point, right? So, or if they're causing pain, or displacing, you know, normal structures, or being uncomfortable, or causing systemic illness like lethargy or loss of appetite, loss of activity level, those would all be warning signs. Increased thirst and urination for some tumors can be a big thing to watch for.
Can be a sign. What are therapy options for your pet that has been diagnosed? Obviously, we're here at the U of I, and your specialty is very long listed, but for today it's radiation therapy.
Is what I focus on here.
Is one of them. But what are some of the other options?
Yeah. So the three main pillars of cancer therapy are surgery, radiation, and chemotherapy. The fourth pillar is considered to be immunotherapy, and then there are complementary and ancillary other therapies, supportive, you know, nutrition and other complementary remedies. But by and large, the treatment should parallel the behavior of the disease. So if you have a disease that is locally aggressive but not systemically aggressive, then surgery and radiation are going to be the mainstay of therapy, and radiation typically does whatever surgery can't. So surgery, if you try to remove something with surgery and leave some behind, then radiation might have a role in keeping it from growing back. If it's in a location where surgery can't remove it because removing it would interfere with a vital function or remove a vital part of the body, then radiation might be an option. Like brain tumors, a lot of brain tumors in dogs are not accessible safely for surgery, so radiation is a good treatment for those. So immunotherapy is again the fourth pillar, but it's sort of the holy grail of cancer therapy. If we could teach the immune system to find what it missed in the first place and seek it out anywhere it is in the body and get rid of those cells, that's always the great the great goal. And immunotherapy is currently in a big resurgence. It's very, very exciting to think about what we can train the immune system to do, and also ways to remove the brakes that cancer can put on the immune system, because cancer can release factors that halt the immune response against it. And so there's a whole group of drugs, including drugs called checkpoint inhibitors, that release the immune system to allow it to attack the cancer. So that's some of the new really interesting research that's going on is surrounding the combination of immunotherapy with more traditional surgery, radiation, and chemotherapy.
4 years ago, you were just on, when we had our last interview, you were just on the verge of launching and using the linear accelerator.
Yeah.
How has that technology changed treatment for animals here at the U of I?
So the TrueBeam linear accelerator that we have is can be precise within less than a millimeter. So I can know where my patient is because I have what's called onboard imaging. So we do a traditional CT scan to get images to create a treatment plan, and then I can simulate what I'm going to do with the machine when the patient comes back for treatment. And then when they're on the table and I put them in what I think is exactly the same position, I can then do a cone beam CT. So when we do traditional CT, you send a bunch of x-rays through a patient slice by slice by slice, and we call them slices. It's like taking slices out of a loaf of bread and looking at them one at a time. You look at a two-dimensional picture, and as you move through them, they add up to a three-dimensional representation of what you have scanned. When we do a cone beam CT, it sends an x-ray out in a cone-shaped form, and that takes a radiograph. So you take an x-ray from each of many different angles, and then that digital data is put back together to create those images, the CT. So I can take the CT scan from when we did the simulation, the CT scan from today, and on my machine I overlay them, and I can go back and forth between one and the other, and I can say, hey, I need these to be exactly the same. I want the patient to be in the exact same sub-millimeter precision position, and so I say, I want it to be here. And for it to be there, the computer will say, well, then you need to move 2 millimeters this way, a degree this way, and roll the patient a little bit. And once it says all the corrections that need to happen, I go through and make sure I'm happy with where it is, and I say, make it so. And I push a button, and then the table that they're on, which is called a couch, the one that we have here is a 6 degree of freedom couch, which means that in addition to up and down, side to side, and front to back, and yaw or rotation, it also can do roll and pitch. So it can move so once we position the animal and say, put the patient where I want it, the whole table moves and the patient does not move anymore. So as far as what that has done for animals, because we can be so precise, we can offer different radiation protocols. So in addition to doing a more conventional approach where you maybe know what you're shooting at and you add a margin around it in order to make sure it's always in your beam when you're treating, because it might be a little different every day. Now I can make sure it's not really different every day. It's in exactly the same spot, so I can make those margins smaller, which means that I am not treating normal tissue around it, and that means that I can give more dose at a time. So I can do a kind of radiation called stereotactic radiation therapy, where we do a big dose every day or every other day just for a few doses, and then you're done. Instead of going through a whole month of therapy, there are many tumors that we can treat in a shorter period of time and have a similar effect. So they're away from home less, they're getting fewer short-term side effects and good tumor control.
When we walked into this area here, you were so gracious to give us a tour, and one of the points on the tour was a board, and it had all of these pictures of animals on there. And
our wall of fame.
Your wall of fame. What is the success rate? Have the success stories that you've seen with clients that have used or have been patients that you've used the accelerator on?
We had one dog that came with a very large tumor of the pelvic canal that could not urinate or defecate. It was completely obstructed, and the owner knew that it was going to be, it would be difficult to treat. It was a sarcoma. They don't always respond to radiation, but we started radiation and got that tumor to shrink back to where the dog could urinate and defecate. That dog did well for about a year. And when it came in, it couldn't walk, and it couldn't poop, and it couldn't pee. And so we were able to restore function, went through some physical therapy, and the dog did really, really well. So most of the tumors that we treat have improved quality of life, decreased pain. Nasal tumors bleed less, they have less congestion. So our first goal is restoring quality of life, but we want to give them I want to make their lives better and longer. But better is first. Longer is a close second, though, because they're our companions. That's why we're doing this, because it's not just so we can enjoy time with them, it's so they can enjoy time with us, and we can give them some time back. So I would say that's probably always the biggest satisfaction, is when we restore function. They're less painful, they bleed less, they're able to pass, food through their mouth because we fixed their oral tumor. They're able to pass urine or stool because we've fixed something back in their pelvic region.
Yes.
Yeah.
Are there some side effects? I would think there's probably some
there are.
that maybe pet owners out there would want to know about.
Yep, there are side effects. The short-term side effects are going to be in tissues that turn over rapidly, like the skin or the lining of the mouth. Those are going to show up very early. Those are called early or acute side effects. So they will start a couple of weeks after the first dose of radiation, regardless of the protocol that you're using, and then they last for a couple of weeks. So they gradually get worse, they gradually get better. They're very common, but they resolve as long as we can protect the animals from rubbing or scratching or licking and allow it to heal. So we give them pain medicine and prevent them from scratching. Sometimes they need a cone sometimes. So those are, again, common but manageable. We also have late effects or delayed effects, and those are rare, but they're permanent when they happen. So that would be a kind of tissue that doesn't turn over very often, but does a great job of healing from DNA damage. So your spinal cord is built with neurons that live a long, long time. And if you get a spinal cord injury and become paralyzed from the waist down, you don't just grow a new spinal cord.
Right.
If it's damaged beyond repair, they're gone for good. So same thing with radiation. If we damage a neuron beyond repair, it's gone for good. But it might take a year for that to show up, for that nerve to gradually die off because of that damage. So when we create radiation protocols, we factor in those late effects as being the most limiting issue. So we're willing to put up with a fair bit of short-term effects, and again, typically those are very manageable, especially with this new technology, because I can be very careful with the dose to those tissues. To anywhere I don't want to get a bad side effect, I now can say exactly how much dose I want there. So we have some control over that. But late effects, sometimes you can have things like if you're doing an oral tumor, for example, or a nasal tumor, you might get cataracts. They can have decreased tear production. They could have a loose tooth. They could have a little spot of bone that dies off where they get a sore in their mouth. If it's in their palate, they can get a hole between their nose and their mouth, and those can be frustrating to deal with. So those are long-term side effects that are, again, rare, sometimes consequential and impact quality of life, and sometimes we can just deal with them or live with them.
In our last couple of minutes, and it will take you probably more than that, but I'm sure you could at least give us a little sampling of other clinical trials or research that you're doing here at the U of I, because that's also a big part of your job.
It is a big part of my job, and we all try to be good shepherds, good stewards of our specialty, and I think that cancer is a great example of that translation across species. We do try to look at what works in people and bring it back to animals. We try to look at what happens in animals and help that advance cancer research in people. So that is the basis for lots of the research that we do, is to make cancer treatment better and more successful and more tolerable across all species. Some of the things we do are just to make the lives of cats and dogs better. I've treated a fox and a hedgehog, and I do treat little critters too. We've treated a few birds, we've treated some horses, so not in the machine, but with a radioactive applicator that I have. So so we can be creative about that. But we do so in the whole. So we have medical oncology and radiation oncology, and we're building a surgical oncology part of our service. We have a lot of trials going on right now. Some of those involve radiation, some not. Some are immunotherapy, some are chemotherapy based. Some are using repurposing drugs, old drugs with new applications to help them make other cancer treatments work better. So, I always encourage general practitioners to include the possibility of a clinical trial in their discussion with pet owners who have pets diagnosed with cancer, because we always try to lay out all the options, all the standard of care options, and then for the right owner, sometimes a clinical trial is great. If there is nothing that is known to work, we might have something novel that works. By the time something is made into a clinical trial, we have a reason to believe that it's valuable. The reason we do the trial is to see if that's true, and sometimes it works out and sometimes it doesn't, and that's the limitation of going into a clinical trial. But if you've exhausted other standard of care options, sometimes there's a clinical trial that gives you something new and exciting. Sometimes people just like the idea of contributing to science and knowing that their pet's cancer will contribute to the success of treatment for pets and people in the future. So there's lots of and often there's financial subsidies. So sometimes trials are partially or fully subsidized to offset the cost of treatment to help them get the care that they need. So we have trials for oral tumors, for oral melanoma, for bone tumors, for metastatic cancer, cats with oral tumors. Cats are somewhat understudied, but we have a long track record of research with oral squamous cell carcinoma in cats, and that we almost always have something for cats with oral squamous. So we've developed a good referral base for clinical trials.
A lot going on
here
at the University of Illinois.
We have a big expansion going on. Do you know about that?
Yes, I've been told, and in my back of my head, I'm like, I've got to go back.
Yes.
Got to go back to the
U
of I
should
after
come
the
back.
expansion.
Yeah, so we have a big generous donation, and that's being matched with funds from the university. So we're building out a whole new cancer center part and bringing on more people. So we're expanding our whole service and our physical facilities, as well as our human resources as well.
Well, we will be back for sure.
Good.
Well, Dr. Kim Selting, first of all, a very big and bold thank you for inviting us into your workspace and accommodating us and letting us film. So thank you for that. And also for being such a gracious guest on the Paw Report. We always enjoy our discussions, and you're such a good steward for cancer research and helping hundreds of patients.
Thank you so much. It's good to see you again.
And thank you, our viewers of the Paw Report, for joining us here live on location at the University of Illinois Veterinary Teaching Hospital. We'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.